The views and opinions expressed on My Story Living with Lupus podcast are each individual's experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. Thank you for joining me for another episode of My Story Living with Lupus. Well, we're in the month of May, and the month of May represents Lupus Awareness Month. But before we get into it, have you heard about Ohio, Kentucky doctors among 60 charged in pain pill busts, and they acted like drug dealers? We also have a special lupus champion to tell her story, Antoinette Thames. So, you know what to do. That's right. Grab your cup of coffee, your cup of tea, and if you're listening late at night, you know I do appreciate it. So grab your favorite glass of wine and join me right here on My Story Living with Lupus. Thank you for joining me for another episode of My Story Living with Lupus. Before we get to our interview, did you hear about the state of Ohio and Kentucky doctors among 60 charged in pain pill busts, which they acted like drug dealers? Well, I'm going to tell you a little bit about it. Federal prosecutors charged 60 physicians and pharmacists with illegally handing out opioid prescriptions in what they say is the biggest crackdown of its kind in U.S. history. Some of the doctors are accused of trading drugs for sex, giving prescriptions to Facebook friends without proper medical exams, and unnecessarily pulling teeth to justify writing pain pill prescriptions. At least 5 of the patients, including a pregnant woman from Tennessee, died. The list of indicted medical professionals includes podiatrists, orthopedic specialists, dentists, general practitioners, and nurse practitioners. Prosecutors said that the specialties and methods varied among the accused, but the results in every case was the same. People addicted to pain medication received dangerous amounts of opioids, including oxycodone, methadone, and morphine. They said the illegal prescriptions put as many as 32 million pain pills in the hands of patients. A special strike force from the U.S. Department of Justice began making arrests, primarily in rural areas, which has been especially hard hit by addiction to heroin and pain medication. Most of the defendants face charges of unlawful distribution of controlled substances involving prescription opioids. Authorities say they gave out 350,000. That's right, 350,000 improper prescriptions in the state of Ohio, in the state of Kentucky, in the state of Tennessee, in the state of West Virginia, and in the state of Alabama. Prosecutors described the doctors involved as drug dealers rather than medical professionals and said they were seeing a total of about 28,000 patients at the time of their arrest. If so-called medical professionals are going to behave like drug dealers, we're going to treat them like drug dealers, an assistant attorney general stated. The defendants are accused of writing or filling prescriptions outside of the course of medical practices and prescribing them despite having no legitimate medical reason to do so. So, my advice to anyone, make sure you are seen by a legitimate. These doctors were legitimate, but they were money hungry. And the best way to get their money was to do harm, or should I say, further harm to people and communities. Before you take any prescription drugs, please consult your doctor. Don't just get them from another source. Please. Before we get into our interview with our lupus champion, I want to tell you this. I was contacted by a young lady who received some advice from someone off of Facebook. She was in tremendous pain, and she said this other person told her to go and get her some Benadryl to help with her pain. And so I proceeded to ask her what was her medical history. And she explained to me what her medical history was, what medications she was on. I told her before she go and purchase anything over the counter to go either to the ER or make an appointment with her doctor before taking anything that someone told you to get off of Facebook regarding pain. Even though research has shown that Benadryl has the same ingredients that some pain medications has. This person who told her to go get it didn't even ask her about her medical history or what medicine she was taking. Now, I want everybody to just think, what if this young lady went and purchased Benadryl and somehow the medication she is on had a side effect? What would that individual who on Facebook would have said if she found out that this young lady was harmed? So I urge in and everybody, before seeking advice from anyone on Facebook, please consult with your physician. Premio handmade gemstone bracelets carries an array of men's and women's bracelets, along with a line of lupus awareness and Cancer Awareness Gemstone Bracelets. You can follow them on Facebook or visit their store at Etsy.com or their website at www.premiobracelets.com. That's PREMIOBRACELETS.com. Thank you for joining me back on another episode of my story, Living with Lupus. I have a champion here to tell her story about living with lupus, Miss Antoinette Thames. Hello, Annette. How are you?
I am doing fine, and thank you for inviting me to tell my story. I realize everyone has one, and I feel honored for given an opportunity to do this.
Well, thank you so much for accepting my invitation to tell a story of a true champion who's dealing with lupus. The mic is yours. Go ahead.
Hello, my name is Antoinette Thames, and I am a lupus champion. I have been physically and mentally challenged by systemic lupus for 14 years. I was given the title Lupus Champion by a friend who expressed that he viewed everyone with lupus as a champion. I decided to take a second look at the word champion. In the past, when I thought of a champion, sports came to mind. The definition of a champion reads, warrior, fighter. I decided that these words certainly describe me and us, anyone with lupus. My fight with lupus symptoms that may be associated with lupus symptoms actually began at the age of 9 years old. For me, that included joint pain, chronic rashes, also fevers. Something else happened to me at the age of 9. God introduced himself to me. He created me, therefore he already knew me. This was the greatest thing that could and has ever happened to me in my life. I am thankful and consider myself blessed. After being hospitalized in October of 2004 for a high fever of an unknown origin, a rash also covered my face and body. I remember having pain in my joints so bad that I could barely walk. I remained in the hospital for 2 weeks. Many tests were ran along with the test results and my current symptoms, including the symptoms from the past. I received a diagnosis of lupus. For many years, I had been treated by allergists for what was thought to be just a bad case of hives and severe allergies. I was given steroids, antacids, epinephrine to give myself daily injections, along with antihistamines for treatment. Years later, I realized I was not getting better because I had been given an incorrect diagnosis. Eventually, the allergist told me that I was allergic to myself. Nothing different was done. I still remained on steroids, from the oldest to the newest of antihistamines. The antihistamines were making me sleep most of the day, and the steroids were making me feel so many different kinds of ways. One minute I was sad. The next minute I might feel anxious or even angry. I didn't like the way I was feeling. I developed more and more lupus symptoms over the years, and the ones that I had already had gotten worse. Over the years, I have come to know and understand many things about this disease. I recognize that I can have a lupus flare at any time. This is when lupus tends to be more active. I usually require a visit to the ER for treatment. I listen to my body. There are times that I am so fatigued that I can barely walk from room to room. When my body tells me no, not right now, I listen, maybe later or tomorrow. Mentally, this disease can be very challenging. Depression may play a role in your life. For me, it does. As I mentioned earlier, steroids, prednisone, may have many side effects, which leads me to another experience that I had with prednisone. At the age of 29, I was put in the hospital for excessive pain.